Hi, Kevin Sartin with Non-Master Physical Therapy with an educational video on hip flexor strains. So hip flexor strains are not a super common condition. About 5 to 15% of individuals will sustain a hip flexor strain. It is most common in athletes, especially those that do repetitive motions with their legs again and again. As well as people who maybe were athletes at one time and they think they can still play the sport and they go back to do it and they don't really stretch beforehand and then they strain their hip flexor. So those are the two groups that typically will sustain this injury. The age population is about 18 to 35 where people are most at risk for this. And a hip flexor strain, typically people are going to present with pain in the front side of their hip. It's going to be tender to touch in that area, and they'll typically have pain when they're sitting for periods of time, when they're walking, running, or especially kicking with that leg. With walking, you might have pain when that leg is back because it's getting stretched, or as that leg comes forward as you contract that muscle to swing that leg forward. So all those things can aggravate those symptoms if you've sustained a hip flexor strain. There's 3 different grades of strain that people can have with the hip flexor muscle. The first grade, so the most mild case, you'll have mild pain. You might have a little bit decreased range of motion at end range. Maybe you can't go all the way up or all the way back because of the pain that you have, but it's pretty mild. Grade 2, obviously a little bit more pain. With a grade 2 injury, you'll have some decreased range of motion. You might even start to have some decreased strength with the hip flexors. If you go to push up, you're not going to have quite the same strength with that muscle group. You might also have some swelling or bruising that occurs with the injury. A grade 3 strain, these individuals are going to have decreased range of motion. They're going to have obviously more significant pain. They're going to have weakness. They have probably heard a pop whenever they had the injury, and they might also have difficulty bearing weight through that leg after sustaining a grade 3 hip flexor strain. Depending on the grade of injury that you have, will determine how your recovery is. So if you've had a hip flexor strain, in those first couple of days, if you want to apply some ice to the area to help with the inflammation and pain, that'll be beneficial. And after those first couple of days, if it feels better to switch to heat, you can do that at that point in time. You can also take some NSAIDs to help with pain and inflammation as well. And then physical therapy is pretty beneficial for a hip flexor strain. So depending on the grade of injury that you had, so a grade 1 injury is typically going to recover with a success rate anywhere from 90 to 100% of folks in 2 to 4 weeks. So a pretty quick stint with physical therapy will get you back on your feet and back to doing the activity that you want to do. A grade 2 injury, it's going to take a little bit longer. About 4 to 8 weeks is the recovery time typically. And still about 80 to 90% of folks will find relief during this amount of time. Grade 3 injury sounds terrible, doesn't it? But it still can get better with physical therapy. So about 70 to 85% of folks are going to be just fine with that grade 3 injury. With physical therapy, it's just going to take a little bit longer. So around 3 months typically to recover from that grade 3 hip strain. So anyways, if you have symptoms like this or feel like you have suffered that, now you know what you need to do. So hopefully you found this video helpful. If you need help with anything, have questions, or like us to see you for anything, please give us a call or visit us at our website at nonpt.com. Thanks.